What have you always wanted to know about Boise State Public Radio? Join us for another round Wednesday, March 19th at Mad Swede Brew Hall in downtown Boise from 6 to 8 p.m. Learn more about our operations, news content, and our service mission. We welcome your questions and look forward to sharing more about what we do here at Boise State Public Radio. More details can be found on our website at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. The measles outbreak, which started in Texas in late January, is continuing to spread, with more than 300 cases reported now across 3 states. And Texas health officials are even more concerned after a mother with measles gave birth at a Lubbock, Texas hospital, exposing newborns and their families to the virus. And with vaccination rates dropping in some areas, many health officials are concerned that the virus will just continue to spread to other parts of the United States. So joining us now to talk more about this is Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email at idahomatters@boisestate.edu. And we did get quite a few emails in regards to measles, so we're going to get to those questions. But before we do that, Dr. Pate, I do want to start with the very latest. And this is the fact that this virus has now spread into a third state, Oklahoma. How concerned does this make you that we just keep seeing this virus spread?
Very. It's not surprising because we have seen this with other outbreaks as well, but it is very concerning. This is a large outbreak that can become very much larger, and we've already had 2 deaths. So this does not portend well. The other thing I'm seeing is that we actually have measles cases, active measles cases in 14 different states. And even as I look at Texas, Texas is huge, and the outbreak that's occurring is over in West Texas, but we've seen cases pop up in Fort Worth, in Houston, in other areas that are much more towards the center of the state. I think based on everything, the report of 300 cases that are identified way underestimates. I would be surprised if there isn't something on the order of a couple thousand cases in actuality. We just don't know about them all yet.
So let's talk about these newborns being exposed at a Lubbock hospital. Dr. Pate, can you kind of take us through how something like this would happen? Because I read this and frankly was stunned.
Yeah. So with measles, the virus has a long incubation period. So your listeners will remember that incubation period is the time from when you were exposed to when the disease manifests itself. And that is ordinarily 10 to 14 days. It can be as much as 3 weeks, but it's a long incubation period where the measles virus is replicating in your body, but you don't have any symptoms to alert anybody to it. Then what happens is the first several days or 4 days of the illness are really nothing that would tell us, oh, this is a measles case, because it's typically fever, runny nose, stuffy nose, and then a lot of kids will end up getting conjunctivitis, injection in their eyes that it becomes red and all. But these could be symptoms of lots of different things. It's not until about 4 days after they begin feeling these symptoms that the rash presents. And even then, it can be early on missed because it typically starts up in the back of the neck, the back of the head, maybe behind the ears, then comes over the face. That's when most people recognize it. But during this whole time of the preceding 3, 4, or 5 days that they've been sick, they're very contagious. So the virus is already spreading. So if you have, as in this case, a mom who is giving birth in the hospital, she may not have anything obvious to tell you that if she's got measles, but the next day, 2 days, 3 days, she could have it. And by that time, she has now exposed her newborn baby as well as potentially babies that are in the newborn areas.
Mm-hmm. And Dr. Pate, we should clarify that even if you are a parent who is deciding to vaccinate your child, newborns cannot get vaccinated with the MMR vaccine.
That's right. And so what we have to rely on for newborns is that their mothers already have antibodies from either from infection when they were younger or from the vaccines, and that what they do is they transfer those antibodies to the baby, and that can give babies protection anywhere from 3 months to a year until they are at a point where they can be vaccinated. But what's dangerous is about in like in this case where the mom had not had prior antibodies, she couldn't give those to her baby. And then if there are other babies that also were born from mothers who didn't have the protection and couldn't pass it on to the babies. So now all these babies are susceptible. And the tragic part is if a child under 5 and particularly under 2 gets infected, they're at a particularly increased risk for some really nasty consequences from measles.
Mm-hmm. I want to talk about that in a minute, but one of the things I do also want to talk about, Dr. Pate, is I think misinformation around viruses like the measles, in this idea that it's not that serious, right? Our grandparents got it; they were fine. I will say I have never seen measles, never been exposed to it that I'm aware of. I got the chicken pox though when I was 15. Got a pretty mild case of it. I was miserable. I was so happy to know that I could vaccinate my kids and they've never had it. Same with the measles. Is this misinformation, in your opinion, partly due to the fact that we haven't seen this? We don't know a lot about this. And there was an assumption that, well, it's a virus. You'll get it. You'll move on. You'll be fine. Our grandparents were.
Yeah, well, you've actually brought up 2 important points in your lead up on this question. The first is yes, it is amazing. And we've seen this back in the early days of COVID too. People had trouble believing that COVID, or in this case, measles, is a big deal because I don't, early in 2020, that person may be saying, I don't know anybody with COVID. I don't know anybody that's died. I haven't heard of any of my friends. Well, yeah, it takes time. And so we tend to think that if we haven't seen it or experienced it some way or been touched by a friend or family, then it's not a big deal. So that's one flaw. The other flaw that you brought up is what we call the survival bias. And that is, guess what? If you exist, you, Gemma, me, and then our grandparents obviously survived from measles. If our grandparents had died from measles, then we wouldn't be here. So we tend, so everybody that is living had living grandparents, and they obviously survived. What you don't realize is that there were tens of thousands of kids before the vaccine that died, and they never went on to have children or grandchildren.
You're right. So, Dr. Pate, what about this idea that the MMR vaccine causes autism? I think there's a lot of hesitation still around people being hesitant about this particular vaccine. even if they believe in vaccines, I will tell you, when I was pregnant for the very first time 17 years ago, I interviewed pediatricians and told them I have these concerns there, there's this, link to autism and MMR, and I have to say our pediatrician, Dr. Bob Lindsay, was wonderful. And Dr. Bob sat me down, was so great about explaining that study, about explaining the efficacy of the MMR vaccine, and really put any doubts or hesitations that I had at ease. And so I really credit our pediatrician for that. I'm a highly educated person and I had concerns.
Oh yeah, and it is not a unreasonable thing for parents to have concern because of how this has been presented to them. They, as I have said before, they are victims of disinformation. So what happened that you're referring to is way back in the late 1980s. There was a doctor who was a gastroenterologist who was trying to see if measles virus might explain one of the inflammatory bowel diseases called Crohn's disease. And there was some reason for that to be a hypothesis. Turned out it was not the case. But what he did because he was driven to get notoriety and hopefully a Nobel Prize, he had all this pressure on himself. He published.
Did we just lose Dr. Pate?
Oh, here.
Let's go to a.
Am I back?
There you are. You're
Did you
back.
hear
Look
anything?
at that. You know what? What I heard was if we can go back to he published. So talk about this doctor publishing this report.
Okay, because it was brilliant. So what happened is he published this report of 12 children who had autism and had MMR. But of course, autism was common and MMR was common. So he tried to make causation out of that association. The problem is you couldn't. There were no control groups. And it is ironic that the anti-vaxxers criticize our studies today, saying, oh, well, those weren't placebo randomized controlled trials. Well, first of all, many of them were that they're attacking, but this one clearly was not. It was just 12 people. And now what happened is an investigative journalist investigated all this and started finding out that many of these kids were diagnosed or suspected of having autism before they ever got their first dose of MMR. But it got published in a prominent journal. It has since been retracted. It was determined to be fraudulent and incorrect, but the damage was done. And it has stuck. Many people still believe today, although because of that study, we've done study on thousands of kids since, and we have been able to show there is no association between the two, but that damage is stuck.
So, Dr. Pate, before we go to break, what about this idea of vaccine injury or people dying from the vaccine? This is information that the new head of health, National Institute of Health, Robert F. Kennedy Jr., has said for years. And he is still talking about this.
Yes. It is certainly true that some people do get injured from vaccines. There is no supplement, no medication, no vaccine that is 100% safe for every person. So that is certainly the case. Now, but when it comes to MMR, his statements are just egregiously false. We have 60 years of experience with this vaccine in hundreds of millions of children. So we know, and it does not cause deaths. And the other thing, he says it causes deaths on the same scale as measles. That is not true. Measles does cause deaths. But the vaccine does not. And he also says that it causes all the same complications of measles that measles causes. And that is not correct. And so it is just verifiably false. It's dangerous. And unfortunately, it's feeding into this distrust of vaccines, and then parents aren't getting vaccinated, getting their kids vaccinated, and then we deal with tragedies.
Mm-hmm. Dr. Pate, a lot of questions coming in, actually. So one literally came in while we were in the break, and it's from Edith. And she says, please ask Dr. Pate, I must have been vaccinated in 1965 when I was born, but I hear the vaccine from 1963 to 67 is no good. So should I get vaccinated now? I am 60 years old.
So, what she is referring to is that the first version of the vaccine that was given during those years was an inactivated vaccine, and it did not produce the kind of protection that the live attenuated version, which is the MMR, which we use today, does. So, if that is all that she got, then yes, she should get one dose of the MMR. So if there's any way that she can check, she probably can't at this point. It's been so long. But if she has immunization records, can see, because after we realized that, most kids were caught up with the MMR vaccine. So there's still a good chance that she later got it. But if there's doubt, then yes, it's very safe, very easy. She can just talk to her doctor about getting a dose of the MMR now.
DJ from Boise wrote in saying, it is being reported on social media that the child who died in Texas died at the hospital after being administered the measles vaccine. Dr. Pate, this is complete misinformation. Can you tell us what we do know about this case?
Yeah, what we do know about this case is that this was a child, I believe 6 years old, in good health, who was not vaccinated and who got measles, and unfortunately was one out of the 5 kids that get measles that get sick enough that they typically have to be hospitalized. And so I can think of no situation where we would vaccinate someone who is already sick with the virus. So that would be incredible incompetence. I think that's just disinformation, and I can't imagine a scenario where we would vaccinate someone who's already sick. The purpose of the vaccination is to prevent you from getting sick. Once you've already got this, it's not going to do you any good. So chalk that one up to disinformation.
And I will say, folks, the Daily Podcast, which is from the New York Times, on March 12th, they did a podcast called The Growing Danger of Measles. And the reporter, Teddy Rosenblatt, was in Texas and actually talked with the child's father, the child that passed away. So if you have any questions about that, you could go listen to that podcast, because there is an interview with the father, and he describes his 6-year-old child and the fact that she was very healthy beforehand, but she was not vaccinated. So if you want confirmation, there is that interview. With that said, another question coming in from Travis, and he says he would like your thoughts on this, Dr. Pate. He said, should lawmakers pass a bill giving doctors and hospitals the right to refuse families or children care that are not vaccinated unless they can prove reasonable cause? This would hopefully protect doctors and hospitals from a lawsuit. Thoughts on this, Dr. Pate, because I think that maybe goes against the Hippocratic Oath.
Yeah, it's. I understand where the question's coming from. I do think it's a slippery slope. First of all, right now, the legislature is trying to look at ways that healthcare providers can turn down patients for things that are really bad ideas and just kind of play into the current narratives. So it's a slippery slope. The second thing is a lot of, as I said, I've never met a parent that wanted harm to come to their children. I know there's isolated cases, but parents that don't vaccinate their kids, they think they're making the right decision. They think they're protecting their children. I don't think we should turn them away. A lot of what happens with low vaccination rates is distrust. And we only play into it by doing that. And frankly, these days, I think about the only people left with that much trust are your own personal doctors. They're the most likely to be able to educate them, just like you said what happened with your doctor with your concerns about the MMR. And so I think it's not the right approach. And I think more harm would come than good. I do think we need to explain, though, for those parents that make the decision not to vaccinate, then when their child is sick, please don't just bring them in and have them waiting in the waiting room. Notify the doctor's office ahead of time. Let's make special arrangements where we don't expose other children until we determine they don't have a communicable disease.
Ingrid wrote in and she says the measles outbreak is spreading across the country. Do we know case levels in Idaho, and do we know the immunization status of Idaho children and teens?
Well, what we know is what is reported. So I checked the Idaho Health and Welfare Department website last night, and there is no mention of any cases this year. We did have cases last year and the previous year, which we did talk about on this show, but none have been reported now. Do I expect we're going to have some? Yes, I think it's coming, but so far, not much evidence for cases here in Idaho. As to immunization rates, we do know that we don't have ideal immunization rates, and that it can create some vulnerability for us. What we don't know is the exact immunization rates for the state, because there's an opt-out, and a lot of people that opt out still got their kids vaccinated, but they just don't trust the state and don't want to give the information. So it's a little bit of an underestimate. The other thing is for measles, you can't really go with statewide averages, because you could look at Texas, for example, and statewide, it might have a marginally acceptable rate. But if you narrow down to that county, Gaines County, where this outbreak occurred, it's really low. And so anytime there's any area or community where the rate is low, you're going to have risk for these outbreaks, even if the state average is good.
I have just under 2 minutes left with you, Dr. Pate, and I would like for you to tell us what your major concern is right now in regards to this measles outbreak, but also what folks should be doing here in Idaho, and really how concerned should we be about this?
I think that the concern is for parents with newborns and toddlers who have not yet been vaccinated. We are seeing, as I mentioned earlier, we know there's cases in at least 14 states of the United States, but we're seeing big outbreaks across the globe. We're seeing it in Toronto, Canada. We're seeing it overseas. And what my fear is that people that used to have comfort that catching measles was going to be a pretty remote thing don't realize that the risks of their child who has not yet gotten to the age of getting that second dose of MMR vaccine. So we're talking about kids in the first 4 years of life. They're traveling internationally, and not realizing that their child may be at big risk. And then the second thing is that people just really don't understand the actual risks. Mortality from other conditions after measles goes up for as long as several years because of the loss of immunity that we talked a little bit about last year that measles can cause after infection. So it's not even if you survive the measles, we see risks from other bacterial diseases and other diseases in the next few years because of the effects of measles on the immune system.
Well, as always, Dr. Pate, do appreciate you coming in and talking about the factual information in regards to this measles outbreak. Of course, we will talk more with Dr. David Pate next week. So if you have any public health questions, send them our way, Idaho Matters at boisestate.edu. This is the Idaho Matters podcast. I'm Gemma Gaudette.